Hi, welcome to GentleBirth TV. My name is Tracy Donegan and I'm the founder of GentleBirth. In this week's episode, we're going to talk about UTIs in pregnancy. So if you've ever had a UTI, you know that it's no joke. But UTIs are quite common in pregnancy, with around 8 to 10% of women experiencing them, and unfortunately around 4 to 5% experiencing recurrent UTIs. They can be symptomatic in that you know you have it because you've got pain when you go to the bathroom or feeling like you need to empty your bladder all the time. But sometimes they can be with or without symptoms. But they can make pregnancy miserable. So why do we get them? Well, during pregnancy, the renal system goes through a lot of changes due to hormones and the growing uterus. And though it might not feel like it at times, the bladder's capacity actually increases in pregnancy. E. coli bacteria accounts for around 90% of all UTI infections. And your blood has higher sugar levels too, making infections more likely. UTIs can develop into more serious complications if they aren't treated. So simply drinking gallons of water won't help, and it'll just make your kidneys work that much harder. There is some evidence to suggest that chronic low fluid intake is associated with the occurrence of UTIs, but taking in lots of water can also flush out the antibiotics if you're taking antibiotics, so they can't really do what they're supposed to do. So I'm going to give you my 10 tips to avoid UTIs in pregnancy. So my first tip, number 1, is always wipe from front to back. 2, peeing after sex, no matter how tired you are. 3, don't hold on to your pee. Empty your bladder when you feel the need to go. Try to wear loose cotton underwear. Cranberries and other foods such as blueberries contain a substance, let's call it PAC, that can prevent bacteria from sticking to the walls of the bladder. The Cochrane Review in 2012 identified 24 studies comparing cranberry products with the control or alternative treatments. There did seem to be a small trend towards fewer UTIs who were people taking cranberry product compared to placebo or no treatment at all, but it wasn't a significant finding. Although some of the small studies demonstrate a small benefit for women with recurrent UTIs. In a pediatric randomized controlled trial in 2012, UTIs were reduced by 65% in girls who consumed cranberry juice with that special element, PAC, compared to cranberry juice without it. So PACs are light and heat sensitive, so store-bought cranberry juice may not do the trick. A more recent 2015 study by Foxman found that UTI incidences were 50% less in women assigned cranberry juice after gynecologic surgery. Another 2015 review of pediatric trials using cranberry concluded that cranberry appears to be effective for the prevention of UTIs in otherwise healthy children, and might be at least as effective as antibiotics. However, recommendations for cranberry dosing and frequency really can't confidently be made at this time. Larger, well-designed trials are recommended. The thing is, cranberry supplements may interfere with blood thinners taken in pregnancy, so be sure to discuss any supplements with your care provider. Another tip is probiotics. So a reduction in friendly bacteria in your body is associated with higher incidences of UTIs. Using the specific probiotics in oral form or 1 to 3 times weekly as a vaginal suppository has been shown to reduce the risk of UTIs and vaginal infections. There were several studies that started in 2015 on the use of probiotics to reduce UTIs, so watch this space. 7, get friendly with fiber. Constipation is also common in pregnancy and can increase the chances of a bladder infection. First of all, if stool gets stuck in the rectum, it inhibits the emptying of the bladder, which can cause you to retain urine. Urine retention leads to stagnant urine, which is a breeding ground for microbial growth, which then leads to another bladder infection. If you can, avoid the epidural. UTIs are more common with catheterization in hospital with an epidural, or do talk to your care provider if you've already decided on the epidural about dosage for a cranberry supplement with PAC before your due date. Number 9, avoid vaginal douching, and 10, avoid hot tubs. I hope you'll find some of these tips helpful in reducing or eliminating UTIs for you in pregnancy. Join me next time on GentleBirth TV.